Singapore Airlines is working with health authorities here and in New Zealand to trace passengers on one of its flights carrying a baby who had measles. Singapore's health ministry says it will get in touch with those who might have had close contact with the infant and advise them to seek treatment if they do not feel well.
The infant and its family were travelling on board SQ281. According to reports, the baby's family had been in the Philippines for 6 weeks and had flown home to Auckland via Singapore on a 10-hour flight. The infant was admitted to a hospital in Auckland on Monday and tested positive for measles. This prompted the New Zealand's Regional Public Health Service to issue an alert. According to a Singapore Airlines spokesperson, Auckland's health authorities were the ones who informed the airline. SIA says it's helping both Singapore and New Zealand health authorities with contact information of passengers who were seated close to the infant and its family. More than 270 passengers were on board the flight. Experts Channel News Asia spoke with said measles, which is a notifiable disease in Singapore, is highly infectious. Signs and symptoms include a bad rash, fever, conjunctivitis and a cough. But the risk of an outbreak in Singapore is rare. That's because most Singaporeans have had at least 2 doses of the measles, mumps and rubella or the MMR vaccine. In Singapore, the first dose of the vaccine is given at 12 months of age, and until 2011, the second dose was given in primary 1.
In 2010, there were 54 cases out of 5 million people, but in 2011 it had gone up to about 143, which was almost a tripling of measles cases. So at that point, the Ministry of Health had changed the policy to bring measles vaccination down to the second dose being given at 18 months of age to protect all Singaporeans.
The Health Ministry says there were 46 confirmed measles cases last year. A majority of them were in children aged below 12 months.